Thank you, Mr. Speaker, and I thank my colleague for yielding. I rise to extend my support for this rule and the underlying legislation. This legislation funds critical bipartisan health programs that help keep our communities healthy. Mr. Speaker, I have long been a strong supporter of CHIP because I've seen it in action back in my home state of Alabama. I served on the Alabama State School Board back when Alabama implemented our CHIP program, known as All Kids. All Kids was the first CHIP program in the country, and it has made a real difference. In fact, the uninsurance rate for children in Alabama has gone from 20% pre-CHIP to 2.4% today. For 83,000 Alabama children under 19, the program offers low-cost, comprehensive health care coverage that includes regular checkups, immunizations, sick child doctor visits, prescriptions, vision care, dental care, and much more. CHIP has always been a bipartisan program, and I hope this reauthorization will earn bipartisan support for the children of America. This legislation also reauthorizes the Community Health Centers Fund. I'm a huge champion of community health centers because, again, I've seen them work in Alabama. From the Mosteller Medical Clinic in Biola Battery to Franklin Primary Health in Mobile to Southwest Alabama Health Services in McIntosh, these centers are vitally important to so many Americans, but especially to low-income families and those in rural areas. 1 in 13 people nationwide rely on a health center for their health care needs, and this reauthorization is necessary to ensure those individuals continue to receive access to medical care. This legislation also includes many other health care provisions to meet other priorities. Among these provisions, I am pleased the legislation continues Medicaid Disproportionate Share Payments, or DISH, as they're commonly known. DISH provides funding to hospitals that treat a large number of indigent patients. DISH is absolutely critical to the life of Alabama's hospitals, and failure to renew these important payments could result in numerous hospital closures in our state. So, Mr. Speaker, I urge my colleagues on both sides of the aisle to get behind this legislation and ensure it gets across the finish line. We should not let petty political arguments keep us from ensuring that children have access to affordable health insurance, keeping the doors open at community health centers, or allowing Alabama's hospitals to continue serving communities in need. And I yield back.